Detroit has made a massive and admirable effort to get its residents vaccinated, and yet, according to the state, as of today, just 25% of Detroit residents are fully vaccinated.
A far cry from where public health experts believe we have to be, but the city is also preparing for an influx of people on June 1st. Capacity limits will be lifted or eased, and then July 1st, the governor says mask mandates and gathering limits are going to be lifted for everyone, regardless of vaccine status, and that has some experts highly concerned.
I won't breathe easy until 70% of the population is vaccinated.
Dr. Nigel Paneth is a professor of epidemiology at Michigan State. He is among those experts who believe the state is moving too quickly.
And I think if we relax all our restrictions before a sufficient number of people are vaccinated and before we've really gotten control of the epidemic, I think we might see a fourth wave.
He is particularly concerned about children under the age of 12 who are too young to be vaccinated.
Last year, the vulnerables were the elderly. Now the vulnerables are the children. They're the ones who are unprotected. And everybody who keeps the virus circulating by walking around without a mask and unvaccinated is putting children at risk. It is putting children at risk.
And with many who are unvaccinated also unwilling to wear masks,
that's the perfect storm. The people who are most likely to transmit infection because they're unvaccinated are also the people most likely not to be able to control the transmission of infection.
The risk of a fourth wave may be especially high in areas like the city of Detroit, where vaccine rates continue to lag in spite of the city's efforts.
It is the highest priority right now, getting the highest proportion of the population immunized, because we're only at 25% vaccinated, fully vaccinated in Detroit. So I unfortunately think we're moving a little too fast on the opening up.
Dr. Paneth is not giving up his mask yet either.
When I go to a supermarket, I still wear a mask. You know, fully vaccinated isn't 100% proof against disease. It's 95%. And I don't want to be in a position where I might be asymptomatically carrying the bug and giving it to someone else who's unvaccinated.
Now, everyone will obviously be watching these numbers in the weeks to come. Dr. Paneth says he hopes the governor and health officials will take action quickly if we start to see cases ticking back up.